Today I'm so pleased to have Dr. Vasanth from Chennai, India, who's here in our California office. And so we're going to have a nice conversation about dentistry in India and in the developing world. Dr. Vasanth has been a POS student since the early 90s. He actually flew from Chennai to Singapore to take our whole series, and so made a huge commitment way back when to learn ortho and bring ortho at the international level back to Chennai. He's also been the coordinator of our courses in India for a very long time, as well as our instructor in India, and has taught many, many dentists throughout India how to do the highest quality ortho, as well as he also teaches multidisciplinary dentistry, as well as occlusion, and has a lot of wonderful perspectives from a very long dental career in Chennai, India. So welcome, Dr. Vasanth. We're so pleased to have you here and to learn from you. So first of all, how did you decide to make the decision to fly to Singapore and start learning ortho way back, 1991, 1992, if I remember right?
Yeah, it's a big story. I want to do orthodontics. Frankly speaking, after almost 15 years of general practice, I got burnt out. Then I saw a magazine and decided on this course. But the expense was pretty high. And with no internet at that period, and not much of way to know what things are, it's really surprising for me now how I even decided to do the course. Imagine 12 visits, 4 days each, almost 60 days I lose, and then $15,000 was the course that time. If you ask me how I did it, I don't know. I just took the plunge. 2 months later, I realized I had so much cases to do. I was in 50 cases in 6 months. So that made up my financial situation. And again, believe me, orthodontics is not just orthodontics. If you know ortho, it's different. For example, if I know endodontics, I do root canals. It doesn't change anything for me. But if you know orthodontics, it's a difference. I don't know how to explain it. It makes you different, it makes you think differently. My whole practice changed.
So I think that's something that you've definitely, in our conversations over the years, I've known you for a very long time. You know, that's one of your big passions, is the fact that ortho and multidisciplinary dentistry, where ortho has a role in every one of your cases and is evaluated and is a big part in where you see how to best treat your patients and how to give them the best care.
Exactly. See, in the last 10 years, I'm doing a lot of work on TMD. You know, TMD is a topic which is, like, you want to make somebody, a dentist, uncomfortable, start TMD.
Yes.
You understand? Occlusion and TMD are sort of things which are kept aside.
For sure.
Nobody wants it. I realize now, when I have a TMD patient, migraine, vertigo, neck and shoulder pain, tinnitus, I diagnose them with a splint, and then the difficult part, how to treat them.
Yes.
Right?
Yep.
I have 3 tools. I need to grind some teeth, do full mouth rehabs, put crowns inside, or do orthodontics. Unfortunately, if I don't know orthodontics, that huge tool is not used.
Right.
So most patients get more crowns they need.
Right. And so you've always made the opinion of, you run other courses, other topics in India, trying to teach Indian dentists how to see cases from a multidisciplinary perspective, understanding all the different areas so that they can see all their options and present all their options to the patient.
Exactly.
And get the best results.
Exactly. When you talk of dentistry, we either fill teeth or drill teeth, extract teeth, and move teeth. Unfortunately, the moving component is unknown to most dentists. It's kept away.
It's a very big hole in their education.
A very big hole in education.
Right.
So how can I have a real diagnosis when a huge tool is taken away from me?
You end up with compromised results.
Exactly. So when I learned orthodontics, I think that is what changes the whole perspective. You become a different dentist.
Absolutely. And even in a place, one of the things that's always fascinated me is when you are in a place like Chennai or in the developing world, where the fees are much lower. And for a lot of Western dentists, they go, well, how can you do multidisciplinary dentistry and all these different specialties in a place where the dental structure, while there's tons and tons of money in India, dentistry is at a place where the fees are still, relatively speaking, low. But you were able to find a way, right?
Exactly. The problem in countries like India, there's money around, but the dentists are scared to charge. So patients don't know about the quality of the treatment. Right. They think ortho is ortho. X puts an ortho, Y puts an ortho, both are the same.
Right.
They don't understand there's so many things behind it.
Right.
Unfortunately, everybody wants to do good treatment. Nobody wants to do a shabby work.
Right.
But when they're scared to charge, they can't charge enough. They can't give service, good service. So once you make the patient understand the quality is different, it works.
For sure. I think one of the things that I've learned in all my travels around the world is that anywhere where you're offering a superior service, you can find someone that's willing to pay for it. And so a big part of doing dentistry in the developing world is having the confidence to learn the skills.
Sure.
And having the confidence, because that's a big leap, as
Exactly.
you said. Making the leap to go someplace and learn these skills and bring it back to your country can be very intimidating. But when someone does, like yourself, and then shares it with his community, is I think how dentistry worldwide can really improve. And so I've always tried to support you in every way I can, because I really think it's amazing the work that you do in improving the dental community around you and showing what's possible to bring world-class standards even in places where fees are low. So a big thank you for all of your hard work in that way.
Great thing, because see, the way I look at it is, my dental career has two marks. One before POS and after POS. It is absolute.
Yep.
And the difference is so dramatic. When I speak about POS to anybody, I get passionate. I get emotional. McGann is my best mentor. I have so many mentors. Yeah. One of my best mentors is your dad.
Yep. You've told me this many times.
He's always that. And POS always is something special to me.
But let's get into the reason why. Because that's that's a humbling statement to me. I poured my career into training people like yourself, and to have you say my father or this company has meant that much to you. But why is it that ortho and that what you've learned through POS has become such a milestone in splitting your career into two parts?
So two things. In the eastern side, education is a little different. We learn a lot of stuff. It's more cramming stuff into. The Western education is a little different. So I was exposed to Western education through POS. And then the passion people have. The instructors who came to whom I met, they loved dentistry, they loved orthodontics. That passion was there. I found it missing in most teachers.
So when you say the difference between Eastern and Western education styles, what do you mean by that? I think I have a good idea, but I'd love to hear it in your words.
See, we know a lot of information. We sort of cram everything inside.
Right.
And we don't really know how to use it practically.
Okay.
Whereas, that's the reason you find when somebody from the East comes into the Western side and then continuing education, they shine a lot. Now they get the direction how to use it. They are more theory people.
Yeah. So it's the theory versus the practical. Because one of the things that POS has always prided ourselves on is that our education is extremely practical. And the concept being that when you learn from POS, you're going to go back and it's going to change your practice from day one, because you'll be able to see every patient differently. And understanding ortho opens up your mind to understanding TMJ better, understanding occlusion better, understanding.
See, dentistry never teaches me diagnosis.
Yeah.
I have done 1 month in one department, keep extracting teeth. Then you move over to the next department, start doing something else. You never see a whole patient.
Right.
I think that's all happens
everywhere. That's not how your practice works?
When a patient walks in, you had to see everything a little different.
For sure.
And ortho gives you that mindset.
For sure.
Orthodontics makes you look at that way. Right from the face, when you come walking, I look at the face, then so many things happen, right? I don't go into a DK straight away with dental caries or a root canal straight away.
And in a place like India where you have, implants is so popular, every dentist does implants. Ortho is still in the developmental stages at the best, where it hasn't really taken off yet, but we're of the opinion it's going to. Why do you think ortho is attractive or is possible in the developing world, whereas implants has already been there? But why do you think ortho may work out better for them?
The cosmetic side is exploding. Parents want the children to look nice. When I was a kid, nobody bothers about a crooked teeth. They say it's lucky. When you have a protruded canine here, they call it lucky tooth. It makes sense because they want it bad, right? But now they make sure that is corrected, right?
In your opinion, throughout the developing world, and especially in Chennai, the demand is there.
Always there, increasing.
It's just a matter of figuring out the economics and gaining the skills.
Exactly.
The economics is possible, especially with ortho, because ortho compared to implants is a much cheaper material cost. And so I think it's much more flexible for the developing world. So now it just comes down to the doctors learning and educating their patients.
Exactly.
All right, thank you so much for joining us today, and look forward to some more videos.